Hello friends, today we are going to discuss about the individual skull bones. So there are different bones, they were joined with each other, they articulate with each other and they form this skull. And now we are going to discuss about individual bones. Suppose if we take any bone, what are the parts of it, how it is articulate with different bones, other bones, and where exactly they are articulated. These are the things we are going to know about it. So first and foremost, we are going to discuss about the posterior part of a skull, which is contributed by the occipital bone. The occipital bone, we are going to discuss about it. So here we have two skulls, one is colored, another one is uncolored skull, and we have a separate occipital bone. So this particular bone we are going to discuss now. So let me explain about what is the shape of it first, and then we are going to discuss about the parts of it. Then we are going to discuss about each and every part on what are the borders and surfaces and what are the attachments of them. Now we are going to discuss about the occipital bone. So occipital bone, which is present, is posteriorly it is present. Okay, so posteriorly it is present. Here we have this green color one, which I am showing you this occipital bone. When you take the individual bone, it is concave internally, and you see from outside it is quadrangular in shape, and then the foramen magnum, the big foramina which we are seeing here, this foramina is dividing this occipital bone into different parts. So posterior to this occipital bone, the big and expanded part is called as squamous part of occipital bone, squamous part. And anterior to this foramina magnum, we can identify basilar part of occipital bone. So this part is called as basilar part of occipital bone. If you see from below, you can identify the basilar part clearly. So this foramina magnum is dividing this occipital bone into posterior expanded part called as squamous part, anterior part is called as basilar part. On either side of the foramina magnum, we can identify two projections. These are called as occipital condyles. This part is called as condylar part of occipital bone. Okay, so squamous part, basilar part, and condylar part of occipital bone. Now we are going to discuss about the angles of the occipital bone. Now in this, if we just observe from the posterior view, we can identify the superior angle which is present between the two parietal bones and one occipital bone. Superior angle and two lateral angles, here and here. Here is one angle, here is superior angle, and it's a left side angle, and here is the right side angle. So the three angles we can identify. Then we are going to discuss about the surfaces, external surface and internal surface. So here you can see the external surface of occipital bone, and inside you can see this is internal surface of occipital bone. Now we'll discuss about the external surface of occipital bone first. So what the structures are present on the external surface of occipital bone? I just want to turn it posteriorly and I will show you the features which are present on the squamous part of occipital bone. So at the squamous part of occipital bone, external surface, what we can identify, the structures which we can identify is, we can identify a big bony projection. So big bony projection called as external occipital protuberance, and then the inion is most prominent point between the superior angle of the occipital bone and the foramina magnum. We're just trying to show you here. So here is the superior angle of occipital bone, and here is the posterior margin of Foramen Magnum. So between these 2 points, the most prominent point is this external occipital protuberance. So this point we can call it as inion. Then if we just try to see this from the external occipital protuberance, we can identify some lines which are running bilaterally. You can see here, these are the lines which are running bilaterally from the external occipital protuberance. So these lines are called as superior nuchal lines. Superior nuchal lines. Superior nuchal lines, they are extending bilaterally from the external occipital protuberance. Excuse me. I'll show you clearly one by one. Please bear with me. Yes. Here you can see the superior nuchal lines. I just want to try to stand this curl and show you clearly the nuchal lines. Yes, good. Here you can see this nuchal lines which are extending bilaterally from this external occipital protuberance. These are the superior nuchal lines. Then this superior nuchal line, it is giving insertion to sternocleidomastoid muscle laterally, and the medially it is giving origin to the trapezius. And outside of these muscles, it is giving attachment to a fascia called as investing layer of deep cervical fascia. Beneath this sternocleidomastoid muscle, it is giving attachment to splenius capitis muscle. So this is about the superior nuchal line. The attachments of the superior nuchal line are, so medially it is giving origin to the trapezius, laterally it is giving insertion to sternocleidomastoid muscle, beneath it we can identify it is giving attachment to splenius capitis muscle. Then above this superior nuchal line, we can identify highest nuchal lines. These highest nuchal lines, they are giving attachment to the third layer of the scalp called as gallia aponeurotica medially, and laterally it is giving origin to the occipital bellies of occipitofrontalis muscle. So these highest nuchal lines, they are not very prominent. Only superior nuchal lines are little prominent. Then comes so from the external occipital protuberance to the posterior margin of Foramen Magnum, we can identify a crest which is extending. This crest is called as external occipital crest. So this from the external occipital crest, we can identify 2 lines, one on each side. They are running bilaterally. These are called as inferior nuchal lines. So here you can identify superior nuchal lines. Below to this one, inferior nuchal lines. By the way, the highest nuchal lines are not prominent. So between the superior nuchal line and the inferior nuchal line, this area, the area on the external surface of squamous part of occipital bone, it is giving attachment to 2 muscles. Medially it is giving attachment to semispinalis capitis, and laterally it is giving attachment to obliquus capitis superior. Then below this inferior nuchal line and the posterior margin of Foramen Magnum, this area also giving attachment to 2 muscles. Medially it is giving attachment to rectus capitis posterior minor, and laterally it is giving attachment to rectus capitis posterior major. These are the structures which are attaching to external surface of squamous part of occipital bone. Then the structures which are present, the entire area, below this nuchal line, below the superior nuchal line, this area is called as planum nuchale, and above the superior nuchal lines, this area is called as planum occipital. So we have the gallia aponeurotica and occipital bellies of occipitofrontalis, they are present in planum, occipital, whereas the muscles semispinalis capitis, obliquus capitis, rectus capitis posterior minor, rectus capitis posterior major, these are the structures present in planum nuchal area. That is about the external surface. Then coming to the internal surface of the squamous part of occipital bone. Squamous part of occipital bone. So here we are going to see the features of internal surface. Let me show you clearly. Yes, here. So here you can see the internal surface of the squamous part of occipital bone. What are the structures we can identify? First, we can identify exactly at the level of external occipital protuberance. Here you can see internal occipital protuberance. Internal occipital protuberance. So here you can see a small depression. We can feel the depression. Yes, if you touch and feel the bone, you can identify a small depression which is extending above downwards and reaching to this internal occipital protuberance. This groove, it is for the superior sagittal sinus. Superior sagittal sinus. So superior sagittal sinus, dural venous sinus, which is running in the groove on the parietal bones, and then it is reaching to the internal occipital protuberance. Then these two margins, either margins of the superior sagittal sinus groove, that it is giving attachment to falx cerebri. So there is a dural fold called as falx cerebri. Then most probably the superior sagittal sinus, which is extending down and reaches to the internal occipital protuberance, and then it is extending and it is running as the right transverse sinus, means it is joining with the right transverse sinus. And then we can identify from this internal occipital protuberance to the posterior margin of the foramina magnum, we can identify another crest called as internal occipital crest. Internal occipital crest. If I want to show you clearly in this bone, colored one, we can identify somewhat clearly. Yes. So here you can see the internal occipital crest, and this is internal occipital protuberance, and the crest which is extending from internal occipital protuberance to the posterior margin of foramina magnum, it is called as internal occipital crest. Then comes the internal occipital crest. At the lower end of internal occipital crest, which we can identify a triangular depression here, and this curl we can identify somewhat clearly. This is a triangular depression called as Permian Fossa. Permian Fossa in this individual bone. Now you can see somewhat clearly the triangular shaped depression which is present below this internal occipital crest. This area is called as Permian Fossa, where what the structure vermis of cerebellum is present at the level of Permian Fossa. Then what is present at the level of internal occipital protuberance is, so here you can identify the confluence of sinuses. Confluence of dural venous sinuses means the dilation of the dural venous sinuses is exactly present at the level of the internal occipital protuberance. Internal occipital protuberance. Then we can identify two depressions above this internal occipital protuberance and the transverse sinus. So from the internal occipital protuberance we can identify two grooves. We can identify one on either side. These grooves were the transverse dural venous sinus. So above the transverse dural venous sinus we can identify two depressions. Below that we can identify two depressions. So above the transverse groove we can identify two triangular depressions. Below that we can identify quadrangular depressions. So these triangular depressions, these depressions are for the occipital lobes of the cerebrum. Below this transverse groove we can identify two quadrangular depressions. These are for the cerebellar peduncles. So that is about the internal surface of the squamous part of occipital bone. Now coming to the next part is basilar part of occipital bone. Basilar part of occipital bone, as we have discussed earlier, anterior to the foramen magnum, we can identify basilar part of occipital bone. So this basilar part of occipital bone, it is going to articulate with the body of the sphenoid bone. So the fusion occurs almost at the age of 25 years. That process is called as synostosis. That process is called as synostosis. And then, so between these two, the basilar part of occipital bone on the body of the sphenoid bone, we can identify a plate of hyaline cartilage. A plate of hyaline cartilage is present. Then the cartilage is going to replace by the bone at the age of 25 years. So exactly at this point. So as I have colored, you can see clearly the basilar part of occipital bone on the body of the sphenoid bone. So the borders and surfaces, what are the borders and surfaces of this is? So before going to see the basilar part clearly, so once again we just have a review of the squamous part of occipital bone. So squamous part of occipital bone, the surfaces are external surface and internal surface, and the angles are superior angle, then two lateral angles, then the surfaces here, internal surface, internal occipital protuberance, and then internal occipital crest, and then here external occipital protuberance, external occipital crest. This is a short review of the squamous part of occipital bone, and now we are going to see clearly about the basilar part of occipital bone. So the basilar part of occipital bone, it is having anterior surface. So the anterior surface, here you can see the anterior surface of the basilar part of occipital bone. Anterior surface, we can identify, so this is articulating with the plate of hyaline cartilage with the posterior surface of body of the sphenoid bone, as I have discussed earlier. Then coming to the inferior surface, so here you can see the anterior surface which is going to fuse with the sphenoid bone, and then coming to the inferior surface. So I am just turning down to show you the inferior surface. So this is the inferior surface where we can identify a tubercle is present called as pharyngeal tubercle, which is giving attachment to fibrous raphe of the pharynx, and two depressions, one on either side of this. We can identify either side of the pharyngeal tubercle, we can identify depressions. This is giving attachment to longus capitis muscle, and posterior to this one you can identify the anterior margin of foramen magnum, and it is giving attachment to anterior atlanto-occipital membrane, which is giving attachment to this anterior margin of foramen magnum. Then come to the superior surface. Yes, superior surface you can identify inside the cranial cavity, exactly in the posterior cranial fossa. We can identify a sloping surface called as the clivus. So this clivus, the structures which are present at the level of clivus are the pons, then upper part of medulla oblongata, then the basilar artery, the vertebral artery, right and left vertebral arteries, they enters into the foramen magnum and reaches to the anterior surface of the brain, medulla oblongata, and right and left arteries, they joins with each other and forms the basilar artery, and along with that we can identify basilar venous plexus, and below that we can identify tectorial membrane, upper border of cruciate ligament, then apical ligament which is extending upwards from the dens of second cervical vertebra. Then the two lateral borders, you can identify right and left lateral borders, two lateral borders. So inside the cranial cavity, it is lodging the inferior petrosal sinus. This is about the basilar part of occipital bone. So surfaces are anterior surface, this is superior surface, and then here it is inferior surface. So anterior surface, you just remember, it is going to fuse with the sphenoid bone. And then superior surface, inside the cranial cavity, posterior cranial fossa, clivus, and the inferior surface you can identify pharyngeal tubercle and the anterior atlanto-occipital membrane. So that is about the basilar part of occipital bone. Next comes the condylar part of occipital bone. So the condylar part we can identify. So the two condyles are present. Here I am showing you in this uncolored one. So right and left occipital condyles, they are going to articulate with the first cervical vertebra atlas, superior surface of first cervical vertebra, and forms atlanto-occipital joint. Atlanto-occipital joint. And here this anterior margin of foramen magnum. So occipital condyles, they are present either side of the foramina magnum. Either side of the foramina magnum. And the medial margin of the occipital condyles, you can identify two tubercles. You can see clearly the two tubercles. So these two tubercles which are giving attachment to alar ligaments. So these alar ligaments which are separating the foramina magnum into anterior small area, posterior large area. And then what are the other structures which we can identify are, so I am just showing you from inside there where we can identify on either side of the occipital condyles, you can identify a foramen called as hypoglossal canal, which passing the hypoglossal nerve. Let me show you clearly this here in this individual skull bone. Here approximately is present here. Here you can see this occipital condyles. Yes, here you can see hypoglossal canal, which is passing the 12th cranial nerve, then meningeal branch of ascending pharyngeal artery and emissary veins. These are passing through this hypoglossal canal. Then about this hypoglossal canal, you can identify a tubercle. Yes, here you can see the tubercle called as jugular tubercle, and then a process which is extending above and posterior to this jugular foramen called as jugular process. So you have to remember jugular process above the jugular tubercle, then below the jugular tubercle we can identify the hypoglossal canal. So that is about the condylar part of occipital bone, Then comes to the foramina magnum. As I said you earlier, the alar ligaments which are attaching to the tubercle of the occipital condyles, they are separating this foramina magnum into anterior small area and posterior large area. So anterior part is called as osteoligamentous canal, and then posterior part is called as neurovascular canal. This is about the foramina magnum. And here we have seen all three different parts of the occipital bone. Okay, so squamous part here, then we can identify condylar part. Here you can see the condylar part, and then this is about the basilar part of occipital bone. Thank you.